3, 4, 5, 6, 7, 8, 9, 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Can they hear us in Baghdad?
Could you hear the, good. There's some gnats coming up right now.
No? They're offline?
You got those gnats? Okay, cool. Great. Iris down. Yeah, I was, all right, thank you. See you, bye.
Shells at him, right?
Not me. I'm a good guy here.
Hard not to notice your lanyard.
Oh yeah.
Audio test 1, 2, 1, 2. Pentagon Press Briefing Room. Can you hear us in Baghdad? Testing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Doesn't look like it.
Just wasn't even mine. Just walked in and said, hey, we're reading.
Yeah, because there's a night day difference from the tech mic and the podium mic. Or the table mic. Can you have them talk now? Say it again.
Yes.
Okay. Can you say something for your opening statement? Can you hand the 25, please?
Are we up?
We're still setting levels.
good to see you. We're just moments away, we're working some technical things up.
Do we have them?
We don't have images, we may hear momentarily. We're talking to them.
How do we say the Iraqis' name?
Alkasir.
Alkasir, not Alkasir.
Alkasir. Quraish Alkasir.
With an A, S-A, or I?
It's spelled S-I-R.
S-I.
Alkasir.
Kasir?
See?
Quraish
My
Alkasir.
expert.
Quraish, his first name is one of the famous tribes in
Apparently they had multiple lenses, so that's why they didn't establish a list. Okay, we can see you now, General Walsh, can you hear me? Oh, can you move closer to the mic? I do, but there's some background noise. We may just have to look at it.
Did you read the SIGAR report? Oh, what was this? Oh, is this a report? The Special Inspector General for Iraq
No.
report.
Today?
No, it came out in April. It came out when I was on vacation, so I missed it, but, there was something, Bowen was testifying yesterday about one of the things that they talked about was the healthcare, these hospitals. Yeah, and there's this children's hospital down in Basra that,
Oh, I know that, I know.
that's the old one.
The famous.
Yeah.
It's just got background noise.
Let's get it going.
Okay, so stand by, we're gonna get started.
Peter, I need you to
Next
call
question
my
here.
Thank you.
There we go. Good morning. Can you hear me in Baghdad?
Yes, we can hear you.
Brian Whitman at the Pentagon. Good morning to the press corps and good afternoon to you gentlemen. Today we are joined by Brigadier General Michael Walsh, I think whom all of you here actually know, who is commander of the Army Corps of Engineers Gulf Region Division. And he is joined by Dr. Quraish Alkasir, who is the president of the Society of Iraqi Surgeons and advisor to the Iraqi Deputy Prime Minister. They're speaking to us today from the Coalition Press Information Center in Baghdad, and we'll be discussing the ongoing efforts in the area of Iraqi health care. They have a few comments that they would like to make about this, and then are going to take some of your questions with respect to this topic. So with that, gentlemen, let me turn it over to you to open it up.
Well, thank you very much, and good morning, everyone in D.C., and thank you for your interest in the Gulf Region Division and the Iraqi Reconstruction Program. I'm glad to be here this morning with my colleague, Dr. Qurais, to discuss the status of the healthcare construction. As you know, the United States contributed almost $22 billion towards Iraq's reconstruction efforts, and of that, $376 million went to the healthcare sector. The U.S. contribution was intended to jumpstart the rebuilding efforts here in Iraq and help the Iraqi government lay the foundation upon which to continue to recovery and rebuild their country. Every day in Iraq we see the fruits of our labor. Many of these successes are things in America that we take for granted. One of them is access to local medical facilities throughout the country. The Gulf Region Division is working on renovation projects at 20 different hospitals. We're also constructing 138 primary health care centers and constructing one new specialty hospital, all of these are focused on pediatric care or maternity care. One of the hospital's renovations highlighted includes the Najaf Teaching Hospital. This project was a full renovation of a 7-story building with 13 operating rooms. The renovation was done in 3 phases and includes upgrades to the doctor's residence as well as the ancillary buildings, and all of the systems, the heating, ventilation, air conditioning, plumbing, electrical, oxygen sensing, reverse osmosis machines, and ultra-clean air systems were all added to this project. This was about a $14 million project, and it was completed by an Iraqi-owned business. This hospital employs more than 1,200 people, about 200 of which are doctors. More than 250 students are trained at this medical facility. Another area that ensures the people of Iraq have access to health care are more than 138 primary health clinics that we're building. The clinics are located throughout the country. 46 are in the north, 34 in the central region, and 58 in the south. Currently, 18 clinics are completed across the country. 8 are open to the public, and 10 are recruiting and training staff. More than 80 clinics are at the 90% complete stage and should be turned over in the next several months. 8 clinics that are currently opened, as I mentioned, are seeing more than 250 patients each day, clearly filling a need. Gulf Region Division outfits each one of these clinics with medical and office equipment and furniture, pretty much a turnkey operation. We're also building state-of-the-art 94-bed pediatric oncology training hospital in the south, along with our partner, Project Hope. The Basra Children's Hospital will be the first new hospital built in the country since the 1980s. We are working closely with the Ministry of Health, who wants to make the Basra Children's Hospital a center of excellence in technology, practice, training, and administration. The project is currently at 51% complete and is on track to construction complete in July of 2008. Right now, an average of 700 workers are on site daily to ensure that that project continues to progress. We also provide development and training for more than 1,000 Ministry of Health employees. All of the construction and the development programs are done working very closely with the government of Iraq and our partners. And I'd like to turn the floor over now to Dr. Quraish, and then we'll be happy to answer your questions. Dr. Quraish, as mentioned, is a surgeon. He's an advisor to the Deputy Prime Minister Zobai and is the president of the Society of Iraqi Surgeons. And I'm honored that he's here with us today.
Really, thank you, General Walsh. Good morning, friends in Washington, D.C. Thank you for being, for letting me to be here and to tell my friends what we are doing here with the cooperation with our friend the American and the coalition forces. Really, since months or years, I can say that our cooperation started with putting the strategy for the healthcare. Although my department, as the deputy department, is responsible for most of the services to be issued to the people. Regarding the healthcare, which was taken an important issue for the people, as we had so many problems regarding the hospitals and regarding the ministry itself. So we had put the strategy through the committees, and the committees really started when the big bosses from government and the American started to have the committee, beginning with the Deputy Prime Minister Dr. Salam al-Zobai and Ambassador Joseph Saloom made the big committee for services of Iraq, and then subdivisions were put, and part of those divisions were regarding the healthcare in all Iraq. We had put the strategy for that, looking for the best thing to give it to the people. We really started with the manpower, with the doctors, and really regarding my issue as the president of the Iraqi Surgical Society, as the dean of the doctors and the department of one of the big hospitals. I started to look for my friends who left Iraq, and I'm still, connecting them. And I brought some of them back, and I'm trying to put the work in the hospital to come back again to be better. Regarding the work that was done, was put through the committees, the JPC committee, which was put after we started the work, and we through this joint planning committee, we put our ideas first, then we put it on maps according to the areas, and then we put it really on the ground for reconstruction, sending it to the JIROC people to do the job. We have really the Iraqi and the American, and really I represented the government to go with my friend the American, and we visited so many projects regarding different issues for services, but we insisted on the healthcare. As General Walsh told you about the different areas where the projects built, regarding Baghdad, where now we are having the security plan, we had took some care for the areas which really was hot and there are some violence, and we went there and we visited those projects, and we found them, they are going on, and everything is the people are happy about that, and the hospitals and the public health clinics which were built by the friends, the American, really are taking into life. The people are visiting the clinics, and I was that happy because they were built in a very nice map to put the people to get the services in the right way. We asked the Ministry of Health to have their representative with us in order to cope with the follow-up for the clinics and the hospital. We had visited so many areas where reconstruction and renovation were done, especially the Al-Alwiya Children's Hospital, where so many important wings was added to the hospital, and so we found that the hospital was crowded, and we visited that hospital with my colleague just 1 month ago. Still, our strategy is to continue using the American money for the health care, to give better services in the future. My strategy through being as a president of the Iraqi Surgical Society, 1, and 2, as an advisor for the Deputy Prime Minister, who is responsible for the services, I am putting the steps, and I'm just running with my friends to give better health care for the people. Really, at this moment, I want just to present my really thanks and great to my friends, the American here in the JPC, in the JROC, for what they have done and for what they are doing now. Thank you.
Certainly, the work in Iraq is challenging and difficult, and the reconstruction efforts are a vital component to Iraq's progress. Ultimately, however, it's up to the Iraqi people to rebuild and secure their country. The U.S. government and the government of Iraq continue to work together to ensure for that success. We're now ready to take your questions.
Well, gentlemen, thank you for that overview. We do have a few questions here. Let's start with Pam.
Hi, this is Pam Hess with United Press International. Dr. Quraish, can you tell us more about the doctors who have left and who have come back? How many doctors left Iraq, say, during the occupation? And how many have you been able to attract back?
Regarding the doctors who left Iraq, I don't blame them. Definitely, you are seeing me. I am a doctor. I am an old doctor. I haven't left. You would ask me why. I said that in the CBS News. I said it's my country. I should serve it. But the problem of security, which put the people to leave the area for a time being, I think they are strictly in contact with us. I can't tell you how many in numbers, because you know that some of them are abroad and some of them are still hiding, and the people think that they are abroad. I am really in contact with the people. I am in contact with the doctor, not because I am in the government, but because I am the president of the Iraqi Surgical Society. I am the man who is looking for the science to be given to my people and to just to follow my colleague and not to leave them. We are waiting to have better situation in Iraq in order to let the people who are really abroad to come back. And they are waiting. And they're waiting for us as a government, as a coalition forces to stabilize the country and then to come back. It's not a big problem we are putting in advertisement that all Iraqi doctors left. I don't blame them. They went because of the violence, and the violence came from the criminals. And once we get rid of the criminals, they will come back again, definitely.
How many doctors are currently at work in Iraq?
Regarding, we have, doctors are of different ages and specialties. Regarding all specialties, we have lost at least more than 30% of the specialty. But the people really are doing, the left people are doing the job now. I'm sure you are looking daily for the violence and the ambulances taking the patient to the hospital. They are not going to hotels, they are going to hospitals. And who is treating them? They are the doctors. I'm sure we can't tell the names, we can't tell the number because, some of them, they leave for a while, for a month or 2 months, and we should bring somebody to stay instead of them. So we can't tell a strict number, but all hospitals in general are giving the work which is, the minimum work which is needed for the people.
Joe, go ahead.
My question is for Dr. Dr. Alkasir. This is Joe Tabit from Al Hurra. Doctor, I would like if you can explain to us details about the public health care policy regarding the Iraqis. The Iraqis need to have medical insurance to have access to your service.
Sorry, I couldn't get your question because, the sound is getting harsh,
Could you repeat your question?
I will try again. Dr. Alkasir, my question is if you can explain to us the public health care policy in Iraq. What the Iraqis need to have access to the healthcare services. Do they need medical insurance? Is your service for free for the Iraqis? Maybe if you can explain for us more details on your policy.
No, I got little, part of the question I could understand, but regarding the policy of healthcare in the Deputy Prime Minister Department, we have a big department, really, I created that, which is full of brilliant people, that they are now putting the strategy how to really cope with the healthcare in Iraq. We have an operating room regarding the Ministry of Health and Ministry of Education to get their problems and to correct and to put the strategy for the future. It's not the long future, no, it's the future, the near future. We are thinking of the drugs, the problem of drugs. We are thinking of the renovation as our friend the American are doing it. The policy really, our policy is to have the minimum doctors to do the work and to secure the other people. I don't want to have all doctors to stay in hospitals in order to be killed. I will let them go in a secure place in Baghdad, in their houses, in some secure places, waiting. Not all doctors left the country. My policy is to have the minimum doctors to do the job, and then to have the equipment to be handled to the hospital needed at this moment. By now, I am not looking for cold cases. I am just dealing with emergency. Cold cases can be done in different areas of Iraq. But regarding Baghdad, we are, as you see, we are just looking to help the people for the violence, for the trauma. So our policy was put, and to say it, the truth, I will not tell anybody what I am planning, because I haven't finished that plan, and I want to be secret for time being. And if you know how many doctors are hiding in Baghdad, in their houses, you will be surprised, and you will say, none of the doctors have left by now. So.
Perhaps I can help with the second part of the question, which you may not have heard. I think that there is some interest in understanding the access to the healthcare system and whether or not all Iraqis have access to that healthcare system, if insurance is required, if it's all public funded, those type of things. If you could give some characterization of how the healthcare system is currently operating.
You know, regarding you know, although I couldn't get the whole question, but I think you meant about the funding of the healthcare system, or the people payment to the hospital. We have a free treatment in the hospital, and regarding the funding, we got a lot from our friends here, and we have our you know, really money from the petrol. We have put the plans, and I think we are doing the right work at this moment.
Very good, Doctor. Now, I think that did address specifically what we were looking for here. Let's go to Jim.
This is Jim Mannion from Agence France Presse. Could you say how many people are treated each day in Baghdad as a result of the violence? And generally, what is the scale of the requirement for health care? How many people have to be treated who are not being treated now?
You know, regarding the patient that the hospital are receiving, you know, there are different injuries. You know, we daily receive in our hospitals in Baghdad, let's say, for the violence you see in the media, you know, let's say at least the injured 50 to 75. They are divided in different hospitals. Regarding the equipment, by now, you know, the surgical needs are present for time being. And I think we are helping the Ministry of Health in getting the needs with the help of our friends here, the American, when sometimes we need them, they send us part of the equipments from the Army, and sometimes we bring the patient to the green zone in the American hospital, in the Iraqi American hospital. Regarding the hospital, I will, you know, tell you the truth. We are having shortage. We are not fully equipped. We are in a war against terrorism, so we expect to have some shortage, but we are doing the minimum work to be needed for the people. We haven't left a patient without surgery because of anesthesia. We haven't left a patient having an open wound without suturing. We haven't left a patient without thoracotomy for an injured chest. So, but we don't have the best bed. We are not having the best ICU. We are not having the best Doppler or ultrasound. We are doing the work with the machines that we are having. And we planned really for the future to have the best instruments. And we are having the group or committees in the Ministry of Health. We prepare them to import it and to select the best for the Iraqi citizen in the future.
Carl.
My name is Carl Osgood. I write for Executive Intelligence Review. My question is for General Walsh. We've seen reports from the Special Inspector General for Iraq Reconstruction, from congressional testimony, that by and large the reconstruction in the health sector, at least as performed by contractors, has largely failed. That there was a contractor that was supposed to build 150 clinics in Iraq and they succeeded in finishing 8. That the Basra Children's Hospital is way behind schedule. And so I'm wondering, has the Corps of Engineers taken over for what these contractors were supposed to do and failed to do, or what is the story there?
Right. The primary health clinics were the prime contractor was a U.S. firm that was not able to get all the work done. So the Gulf Region Division asked them to to stop their work, and we reawarded the work that firm was supposed to do to their subcontractors. Since we've reawarded that work to the Iraqi subcontractors, they've been doing some excellent work. As I just mentioned, about many of them are over 90%, and we'll be turning them over in the next couple of months. In regards to the Basra Children's Hospital, again, that was being done by another Western firm that was not doing good, and that contract was terminated, and we went with a Jordanian contract to finish on that. And so, as I mentioned, there's about 700 construction workers that are on that job day in and day out now, and things are moving along much better than they were a year and a half ago.
Go ahead. Sir, Fred Baker with American Forces Press Service. When you say they're 90% ready and to be turned over, when they're turned over, are you talking full operational staffing and funding by the Iraqi people, or will those still be augmented by American forces?
No, that will be what I meant by fully turned over. Turnkey means that they will have x-ray machines in it, they'll have dental chairs, they'll have the facilities that they need to run a primary health clinic. We will be taking some of the staff and training them how to operate some of those systems, but then it'll be turned over to the Minister of Health, and the Minister of Health will be operating them, staffing them, bringing consumable supplies in.
Let's go back to Pam.
Dr. Quraish, this is Pam Hess again. Could you talk to us specifically about the problem of security at the hospitals and clinics in Baghdad? We see on the news that there are people who are afraid to go to the closest clinic because it's a different sect, or it's in a different neighborhood ethnically, or a different sect of the, you know what I'm saying, different sect, Shiite or Sunni. At any rate, could you please address the security situation specifically with regard to sectarian violence at your clinics?
Yeah. Really, regarding the security of the hospital, you know, it was a difficult situation just before the start of the security plan. All people knew that, and really, I was one of the doctors who ran from the hospital because of the problem of violence. Once we started with the security plan, we put a strategy for the security for different hospitals. Really, we sat with the main commanders of Baghdad security plan and with the Prime Minister himself, and really, and with the American, and we selected the right people to secure the hospital in different regions in Baghdad. I will tell you the truth, before the start of the security plan, we can say that the minimum people that reached the hospital, you know, they were pushed to go there because of their illnesses and problems, you know. But by now, you can come here and see people started to go to hospital. I don't want to say as before because, you know, we have secured so many areas and we have the people return back to work in the hospitals, and we put people there from the army plus the American, because I want to tell you the truth again that the people believe in American more than the Iraqi. This is an issue we should accept it by now, you know, and they call it as a buffer, you know, the American. So by now in any hospital we can see the Iraqi or the police people beside the American securing the area, and the people are coming to the hospitals now. More than 70% of the people are going to hospital regarding their illnesses in comparison with the previous situation before the start of the security plan.
And a follow-up, would you tell us how many hospitals and clinics there are in Baghdad that are being protected? And tell us a little more about your experience. What hospital did you leave and why?
Yeah, you know, I will let you know about my hospital. You know, my hospital is Al-Karama Teaching Hospital. It is present in one of the hot areas where I live, is Haifa Street. All of them, all people knew about Haifa Street. This is where I live, this is where my clinic is, this is where my hospital is. You know, I was saved by the American, I want to tell you this, and this is because of the terrorists and part of the militias. And the hospital that I was working for the previous 17 years, and I am the head of the department of surgery there, is Al-Karama Teaching Hospital. It was closed for 2 months, before the security plan started. By now, you can go there and you can treat yourself. It's easy to go there and to visit the whole departments, and at least 70% to 80% of the specialists are working, and they come to their department daily to cope with the patient. Another one that was really dangerous to go in was Al-Qadumiyya. By now, you can go to Al-Qadumiyya even if you are from the Sunni group, because the army there, or the Shia can go to Al-Karama, because the army, the American, the Iraqi army are securing the whole ways that get you there. So other hospital is Al-Nu'man in Adamiyya. Now it's secured. You can go there and you can take your advice from the doctors. So many other examples are present, and really within the following few months, I think we will secure the whole hospitals in Baghdad.
How many hospitals are in Baghdad?
Sorry?
How many hospitals are there in Baghdad?
What other hospitals in Baghdad? We have the Al Yarmouk Teaching Hospital. We have the medical city, the big medical city. We have 2 hospitals in Al Sadr area. We have a hospital in Abu Ghraib. We have another hospital in Al Shu'la. We have many other hospitals in the periphery of Baghdad, in Al Mada'in, in Mahmoudiyya. They are all those areas are related. They are related to Baghdad.
Yes, actually, what the reporter was looking for, if you had an actual number, a total number of the hospitals operating in Baghdad.
All the hospitals there are working. We haven't had, a hospital to close their doors completely. Yes, there is limitation of work, but all hospitals are working.
And I think you had listed a number of the hospitals.
Yeah. The number we have 1, 2, 3. There are so many big hospitals and many local clinics. We have 6 big clinics on the west, on the east of the river, and we have 5 big hospitals on the west of the river. Beside the 45 equipped clinics in both sides of the river in Baghdad.
Yes, thank you. That was helpful for context. We have reached the end of our time, and I want to be respectful of the time you've allocated for this and give you an opportunity in case there's something that we haven't addressed or some closing comments that you'd like to make. So let me turn it back to you before we bring it to a close and offer you that opportunity.
Is there any closing comments?
My comment really just to tell the whole world that this is Dr. Quraish, the Iraqi doctor, and this is General Walsh, the American general. We are telling the people all over the world that the army is not here for only fight, or it's only they are presenting the weapons. They started the reconstruction since they arrived. But, I blame the media. They presented the violence, but they didn't present the reconstruction. I said it once, and I said it in America when I met His Excellency President Bush. I told him, we are going to put the seeds. And really, we put it during the meeting when I told him we are starting to build a children's hospital in Basra. And that was on the 15th of December 2003. He said, why you are building that hospital there? I said, they are in need. And I said, we put it. Now we are just collecting the fruits. So this message for all people in both society, Iraqi and American society, that we are here for fighting terrorism besides reconstruction. Thank you.
Thank you, Dr. Quraish, and thank you for joining me here. I would also just like to end that there are lots of good stories that are out there. There's more than 3,200 projects that are been completed throughout Iraq. More than $8.5 billion worth of infrastructure work has been completed by the Army Corps of Engineers, and there's another $3.5 billion that we have on work right now. Certainly, it's very important work, and we work hand in hand with our friends in the Iraqi government to provide services for the people of Iraq. Thank you.
Well, thank you, gentlemen, for your time this morning, and hopefully we'll get an opportunity to do this again in the near future.
You bet. Looking forward to it.